everybody, Jen Reiner here with Fitness Quest 10 and Water and Sports Physical Therapy. We're going to go through 5 hip mobility moves and stretches coming up here. Alright, first we're going to do for the hip joint here, again a mobility exercise. We're going to use the trusty belt again to add that added pressure. We're going to use a bench here. Now for your clients or you yourself, whoever's using this exercise, the bench should be right about just above 90 degrees of hip flexion. So again, knee up a little bit higher than 90. We're going to use the belt here. You're going to plant that bottom foot with the belt underneath the toe, and then it's got to be tight enough that you can feel that belt pressure immediately when you take that leg on up. So I'm going to tighten it down just a little bit more here. And again, make sure you have something for support, something close by, because you're strapped in pretty good. If you lose balance, obviously you could potentially fall. This is great for people that you take the leg or the hip into a passive hip flexion and they report a pinching high in the hip here. This is a great mobility exercise for that capsule. Create a little bit more room, that way when they bring the leg up, it glides a little better, you don't get that pinching at the top. So again, belt is real high here in the hip, aiming directly over the top here, and I'm going to slowly just lean forward ever so slightly, not a lot of weight onto this front leg. If you're pushing down with that leg, you're going to gauge the quad, which will then pop that belt off the hip here. We've got to keep this nice and loose so that the belt can really engage into that capsule. So either you can slightly lean forward, or what I like to do is I actually do a little plantar flexion with the foot here coming up onto my toe, which will really dig that belt down to the hip here. So a little bit of both, a little bit of plantar flexion, a little bit of a lean onto that front leg, not a lot of weight, and again I can feel a nice pull into that hip. A couple passes just like that. Retest that passive hip flexion and see if that made a difference in terms of that pinching with any of your clients that may experience that. Alright, the second one here is kind of a 2-for-1 special. We're going to get some passive mobility going with that hip flexion on the bottom leg here, and then with the extended leg we're going to get a nice stretch through the adductors. So all you're doing on this one is literally just rocking back and forth here. I can feel that movement through the right hip as we go back and forth. And then as far as that leg will extend out, you'll feel a nice stretch on the inside of that adductor right through here. Just back and forth this way, and then obviously we're going to switch into the other side. Alright, so third stretch here is going to be more for the hip flexors. We're going to use an AirX pad or some sort of a mat. I like to use a wall for a lot of my stretches just because you take the partner aspect out of it. So again, close to the wall. The closer you are, the more of the stretch you're going to feel through the hip flexor. The further away, the less. So I'm going to actually start pretty close here. I'm going to bend my knee. I'm going to place my toe onto the wall here and then bring that other leg out in front into a lunge position. I'm going to sit up nice and tall, and I'm going to picture my pelvis like a bucket of water. I'm going to tilt that bucket backwards so you get a posterior pelvic tilt. The minute we do that, we really start to engage more of that iliopsoas for that stretch. So nice burning sensation in through here. Again, 30 to 60 second hold. Now more for the quadriceps, I'm going to lean forward, and then again I'm going to drop my hips down towards the ground, and you'll feel again that burn, probably a little bit lower this time, more of a quad stretch than that iliopsoas high into the hip flexor. So again, 30 to 60 seconds, so you get a 2-for-1 again on this one. Okay, so fourth one here, again, another mobility exercise. This is going to be for internal rotation of the hip. This one feels a little uncomfortable, and this one I can't stress enough, you don't want to push too hard on this. You see kids sitting like this all the time. It can really stress the inside of their knee with that valgus position. So this one, you could use a yoga block. They work great. Stack up as many as you need. This one here, I just actually have the end of an indo board. And what you're going to do is you're just going to sit on it this way and position the legs into a W position. So we call this a W sit here. And again, it just helps with getting that internal rotation nice and easy. You don't want to be putting too much pressure on the inside of the knee and drop down too low on this one. So again, just nice and easy, 30 to 60 seconds sit here. Allow that internal rotation to happen at the joint. Real simple. Alright, last one for the hip here is going to be for the external rotation of the hip. We're going to use the wall on this one just to help, again, with the stretch so we can relax into it. And this one, again, using the towel. This just helps to protect the low back. Chiropractor by trade, so of course, low back here. I'm going to keep safe. You're going to put this right under that small area of the back, maintain that curve. One foot onto the wall here for support, and the other foot's going to do that external rotation. Figure 4 position. Okay, on this one I can just relax because the wall's already keeping that foot up. I don't have to lean forward and pull, which you see a lot of the time. This one here, just add that extra pressure onto the outside of the leg. You can watch that lumbar curve is maintained in through here. Very safe, very good stretch for that external rotation of the hip.